right, continuing with the band. This is kind of going off of what Sean just spoke about with the inferior glide. So that's important for the mobilization, but I want to talk about also the kinesthetic awareness that this can create too. Sometimes a lot of patients, they know what position to be in because we're saying it verbally, we're verbalizing it, but sometimes they don't know how to get into it physically. So to kind of help build that awareness, that consciousness, we can also use the band for that too. So again, find the appropriate band for that individual. And again, like he did, you can bring it up first, place it there, and then step down, okay? And this is more passive because the bands don't know how to work. So let's try to bring it here. Placement is a little tricky. You might need to squat into it, okay? So a little here, and then for purposes here, mobilizing. So we can mobilize here, okay? Right into that kind of groove there. What you can do is also, it's gonna kind of have to be a little more active as well to hold it up. Hold it there, mobilizing it. It's also pulling me into that slight retraction of the shoulder blades, and a little bit of depression as well. Okay, also got some rotation here. Okay, so you can kind of see all around, bringing it up. I'm forced to maintain an erect position. There's no way for me to really slide forward. Because if I go ahead and bend forward, this is just going to slide down the arm. And again, it's going against what we're trying to accomplish. So again, kind of put it right there.
Okay, got it. Perfect.
And then again, it's already getting you into that good position. Again, because if you didn't, you would just fall forward, the band would just slide down the arm. So again, just building that awareness. Get a mirror too. Make sure the patient or the individual can see themselves. So that way they're aware of what their shoulders are doing. Maybe they're tilting here, okay? Maybe they need to correct for that. If they can see it, they have the visual feedback, they can go ahead and correct themselves. And oftentimes, it doesn't take much longer to really get awareness. Weeks down the road, maybe a month down the road, they remind themselves, oh, wait a second, I'm slouching, I'm tilting, whatever it may be. So again, just building that awareness, so that way when it comes time to engage the muscles of the posterior chain in the back, we're kind of ready set up with the foundation. That's that.